Hi guys, welcome to the Eleanor Clarke Slagle Lectures of the 1960s. I'm Claire and my co-presenters are Sarah and Cassie. Okay, so starting today, we're going to give a review and analysis of the Eleanor Clarke Slagle Lectures of the 1960s. It's important to note that there were only 8 lectures in this decade. So we're going to start today with an overview of the historical context of the 60s, just to kind of see how the lectures were influenced by the happenings at the time. Then we're going to discuss the overarching themes across the lecture series and how they relate to each other, as well as how they relate to the evolution of OT at the time. Then we will move on to an overview of each respective lecture and give a brief review of the honorees' notable accomplishments and contributions to the field. And we're also going to touch on the individual themes covered in the lectures, as well as some content within the lectures that support those themes. And then we'll just end with some closing thoughts and impressions.
So just to give you some historical context of the 1960s, American social values had shifted from conservative in the 50s to progressive in the 1960s. Within the profession of OT, the 1960s was a decade of change. In the mid 20th century to about 1980, there was a medical model basis for OT, and there was also a focus on developmental theories where there were different stages where one thing happens after another versus the systems theories that we see today, like the PEOP model, where everything interacts with the other factors. OT was evolving as a science-based profession and stepping away from the arts and crafts movement. Some OTs felt that there was not enough emphasis on the therapeutic use of occupations, while there was too much emphasis on arts and crafts. And the values and essence of the arts and crafts movement in relation to OT was being questioned, while science-based concepts were being brought into the profession. This was reflected in changing practice areas and curriculum design at the OT school level. In OT programs, there was a shift in curriculum, medical conditions, activity analysis, therapeutic applications were being emphasized, and there was less of a focus on arts and crafts related curriculum. And in 1969, the AOTA definition of occupational therapy was: occupational therapy is the art and science of directing man's response to selected activity to promote and maintain health, to prevent disability, to evaluate behavior, and to treat and or train patients with physical or psychosocial dysfunction.
So we really wanted to narrow down the themes of the 1960s into like 3 or 4 categories, but we found there was just simply too much material continuously emphasized in this period to cut any of these themes out. The 1960s were a time of reform and questioning the status quo, and there was a move from conservatism to progressive values. So we found the major themes of this time also revolved around a progressive push. There was critical analysis and a lot of questioning of the current practices, and there was just kind of a general desire for improvement. There was a definite need to define the profession in terms of both the function of OT and the value that we had to offer to the medical field. There was a tone almost as if the practitioners themselves really didn't know their own function and value, just because so many other professionals had kind of been questioning them. And it was apparent that defining OT as well as developing professionalism was necessary for the preservation of the profession. Some other overarching themes also included theory development, developmental theories and philosophy and ideology, challenging educational standards, encouraging scientific inquiry, and there was shifts in expansion and practice, especially away from arts and crafts.
So the first lecture of 1960 was titled Devices, Development, and Direction. This was given by the honoree Muriel Zimmerman, OTR. Some of her notable accomplishments: she was a pioneer in the rehabilitation specialty of assistive devices. She created the universal cuff and the Swedish arm support, which is now called the deltoid aid, which you can see in these pictures here. She was a supervisor of the OT department of the Rusk Institute of Rehabilitation Medicine for approximately 50 years. as well as being one of AOTA's 100 influential people. So we have a couple of quotes on the next slide that define themes of the lecture. I'll just be reading one, and we have a couple of them in the outline as well. So a quote from her lecture is, "We must do everything possible to provide equipment to aid our patients. If this is the answer to their problems, we should never impose anything upon anyone just because it is one way of giving assistance." So her themes discuss the design, function, and impact, including like the physical and psychological of assistive devices. She discussed, there's a discussion of shifts in practice with the utilization of assistive devices while honing in on their physical and psychological impact. She spent a lot of time talking about that, and even like the preparatory work of devices, you know, when we give them to somebody, we have to do it in a strategic way at a strategic time and really listen to what the patients have to say about the device and finding ways to make them feel good about it and seeing that it's a tool, not like a crutch for the rest of their life. She also had a discussion of the encouragement of scientific inquiry and development, which seeks to create the most adaptive, suitable, and diverse equipment. And then there's an attitude of always striving to create better devices. So there wasn't like a one device fits all. It was always striving to either make it better or adapt the device personally for each client.
So in 1961, Mary Riley gave the Eleanor Clarke Slagle lecture titled "Occupational Therapy Can Be One of the Great Ideas of 20th Century Medicine." And as we have heard, Mary Riley was a big player in OT. She did a lot for our profession. She was the founder of occupational science. She also founded the Occupational Behavior Theoretical Frame of Reference. She basically redesigned USC's Masters of Occupational Therapy program and served as their department head. And she was one of the first 3 individuals inducted into the AOTF Academy of Research in 1983. So the themes that she hit on in her lecture were the value of OT, defining OT, and preservation of the profession. She really put an emphasis on the need to define the profession of OT because the 1960s was a tumultuous time as it was moving away from arts and crafts and more towards a science-based focus. She acknowledged that OTs have been able to reinvent the profession according to the needs of patients or clients since its inception in the early 20th century, but also insisted that the profession must define itself so that society understands the value that OT provides. This lecture was a call to action for all OTs to think about and provide proof of the value that they, as OTs, bring to the medical field and society as a whole. What I found really interesting and kind of disheartening about her message was that it's still pretty relevant today, and it's exactly 6 decades after she gave it. And some quotes that I wanted to share are the really famous one, "Man, through the use of his hands, as they are energized by mind and will, can influence the state of his own health." So that was at the beginning of this lecture. Some other ones that I also thought were relevant to the themes that I found were, "Is occupational therapy a sufficiently vital and unique service for medicine to support and society to reward?" And this was the question that she was trying to answer with her lecture. She also said, "If we fail to serve society's need for action, we will most assuredly die out as a health profession. And the crucial nature of our service cannot be spelled out in the loosely constructed way that it is today." So those are just a couple of the quotes from her lecture that supported my themes.
Thanks, Cassie. So in 1962, we have Nadia Ackley presenting The Challenge of the 60s. Just a little bit of overview about her. She had about 30 years of experience as the director of OT at the Trenton Psychiatric Hospital of New Jersey. She was also one of the earliest registered OTs. When I first read her lecture, it seemed really hard to follow and a bit random in its format. I couldn't quite tell what the overall point she was trying to make. But after overviewing the lecture or all the lectures together and comparing the common overarching themes, it became apparent to me that her lecture really is an overview of all the major themes that we've already identified and discussed before. And her lecture was within the context of mental health. So I came to realize that her title of The Challenge of the 60s was really fitting, because it truly was just an overview of all the challenges in the 60s that OT was wrestling with. So yeah, I put down a couple of the themes that were touched on in her lecture, but really she touched on all of them that we had mentioned at the beginning of the presentation. So just to share one of her quotes, I'll show the one that's in the pink box. It says, the fact that recreation, library, and music enrich our lives, and that work is an essential activity in our culture, does not make participation in them treatment per se. All I ask is that we do not slip into the fallacy of labeling activity treatment just because it is carried on within the hospital boundaries. I thought that was kind of interesting, because I thought I didn't know whether or not I agreed with that. But it is interesting to think of, like, just as OTs, like, just because we're participating in activity with our clients, it doesn't necessarily make it treatment. But it was also interesting because she never really elaborated on the difference between activity and treatment. So.
So 1963, the Eleanor Clarke Slagle lecture was given by A. Jean Ayers, and her lecture was titled The Development of Perceptual Motor Abilities, a Theoretical Basis for Treatment of Dysfunction. Some notable accomplishments of hers were that she had a background in neuroscience and ended up being the founder of sensory integration theory and therapy. She developed the sensory integration and praxis tests. She was also a faculty at USC. She wrote several books and over 50 scholarly articles, and there was actually an award by AOTF that was developed in her honor. So in her lecture, Ayers discussed a research study on perceptual motor abilities, also known as hand-eye coordination, that she performed to describe a hypothesis that related to dysfunction in developmental processes. She used statistical data from her study to outline 5 major syndromes related to hand-eye coordination. Her study aligned with the shifting nature of the OT profession in the 1960s. She emphasized how her study, and I quote, has attempted a comparable categorization of a domain of neurological dysfunction with reliance not upon subjective human judgment, but the objective accuracy of statistical computations. And I really think that this quote exemplifies how the practice was shifting away from arts and crafts and towards a more evidence-based scientific approach to treatment. During the mid-20th century, the OT profession was in a reductionist era and used the traditional medical model, which was evident in the many developmental theories that came out during this time period. Ayers's new treatment approach theory was an important one, and one of the many that began to come out during this decade due to the increased focus on scientific evidence and research in the field of OT. So the themes that I placed her lecture in were developmental theory about dysfunction, shifts in the OT practice, and a new treatment approach.
The speaker for 1965 was Gail Fidler with her lecture, Learning as a Growth Process, a Conceptual Framework for Professional Education. Gail wrote 13 books and numerous articles. She served on AOTA's executive board. She served on AOTA's Associate Executive Director for Practice, Education, and Research. Her scholarship supported the therapeutic use of purposeful activity while exploring its psychodynamics. And then again, she was also one of the 100 influential people listed with AOTA. Her themes included challenging education standards, encouraging scientific inquiry, and defining the profession. And then I'm sure it goes without saying, the little pictures off to the side were her books. And then as far as like diving into more of how the themes played out, she challenged the education standards for the profession of the time, arguing that students need to be taught beyond facts and how to think for themselves. She encouraged scientific inquiry as a need in OT education, as well as a skill to be taught to students to take with them into practice for long-term use. She called for the further and clearer defining of the profession, which would then be reflected in the education. The quote I wanted to use for her, she had a lot of really good ones, but it's hard to narrow it down to just one. But I think the first one probably sums it up the best. It is the privilege and responsibility of a profession to define the kinds of learning which will develop its students' potential for the fulfillment of its education aims. May we have the courage, the knowledge, and the sensitive discernment to prepare professional leaders for tomorrow's practice.
Okay, so in 1966, Elizabeth Yerxa gave the lecture Authentic Occupational Therapy. She was a super impressive woman. Due to time constraints, I won't go too into depth of all of her accomplishments and contributions to the field, but it is certainly worth noting that she received the AOTA Award of Merit, AOTA Centennial 100 Influential People, or was mentioned as one of the 100 influential people. She was also one of the founders of the discipline of occupational science at USC. And I believe she's currently still a professor of occupational science and occupational therapy at USC. Another interesting fact is that she actually knew and was friends with Mary Riley and Jean Aries, which were two of the other honorees from the 1960s lectures. So yeah, just kind of cool to see their connections. So Elizabeth's lecture was really inspiring and an engaging read. Similar to Nadia Ackley's lecture, I found that she had covered so many of the overarching themes that we've mentioned before. But kind of interesting to me, while other lectures seem to challenge and maybe even criticize or call to action, Elizabeth's lecture really came from a place of confirmation and inspiration. So the tone was really different than a lot of the other lectures of this period. She came from a more positive perspective, and she affirms kind of like, hey, look at the rate that we've incorporated our educational standards and how other professions are actually starting to recognize our value. So I thought that that was really unique and a refreshing perspective. This lecture is also unique in that it touched on the philosophy of existentialism and how to practice OT in an authentic and impactful way. So we can go and go to the next slide. And so I guess, so these are two quotes. One of them kind of touches on the existentialism theme that I had mentioned, and the other was on authentic occupational therapy. If you go also to our outline, there's a bunch of her quotes. The whole read was just super inspiring, so I really recommend it. But I'll go ahead and read the one on the right that touches on authentic occupational therapy. So the therapist enters into mutual relation with the client. In a mutual relationship, as Martin Buber said, my thou affects me as I affect it. We are molded by our pupils and built up by our works. The authentic occupational therapist is involved in the process of caring, and to care means to be affected just as surely as it means to affect. So basically, our clients affect us just as much as we affect them, and that's what it means to be an authentic occupational therapist.
For 1967, the honoree was Wilma West. I'm sure most of us are pretty familiar with her. Her lecture was titled Professional Responsibilities in Times of Change. Some of her notable accomplishments were she was the executive director for AOTA for quite some time. She was the president and founder of AOTF. Among the first to receive a master's degree in OT from USC, she was a benefactor of the AOTA Library. She engaged in interdisciplinary work for the US government. It was a bunch of different categories, too many to list, but it was pretty impressive. And then also she was amongst the 100 influential people for AOTA. As far as themes go, she talked about the defining of the profession, shifts in the practice, and then like the theory and development. But this was kind of all within the frame of therapists becoming health agents. So I'll give you kind of a breakdown of the themes. She called for a play of an active role in the definition of the profession, while medicine at large was changing as well. She discussed the need to shift practice from a reductionist mentality to a holistic mentality, looking at patients' treatment and rehabilitation from the perspective of their physical, psychological, and socioeconomic needs. This one kind of touched on, without going too far into it, she was bringing up how there was a lot of community health concepts and like organizations starting to spring up, like the, I'm blanking on the name, I think it's called Head Start, and there's a few other ones, but this was kind of the beginning of all of these community health entities. And she was very big on OT becoming a part of this. And then another theme was suggested a shift in theory regarding the ideology and philosophy behind the role of OTs. She was calling for a transformation of OTs from simply therapists to health agents who were looking at, like at large, looking at the greater interests of the clients, not just whatever they were receiving OT for. And then the quote I wanted to use from her lecture was, I believe we should identify with the field of health services, thus broadening our traditional identification with medicine. We should enlarge our concept from that of being a therapist to one of a health agent with responsibility to help ensure normal growth and development. We should think about the roles of prevention, treatment, and rehabilitation, about socioeconomic and cultural, as well as biological causes for disease and dysfunction.
So our last lecture of this decade was in 1969 and given by Layla Lorenz, called Facilitating Growth and Development, the Promise of Occupational Therapy. So some notable accomplishments of Layla Lorenz are that she is the first and only African-American woman to give an Eleanor Clarke Slagle lecture, which is a great honor, but it would be nice in the future to see more diversity as well. She was a former OT department chair at San Jose State University. She also was a former chair of AOTA's Research Advisory Council. She's received numerous awards. She's a very decorated OT. And she, along with the other two lecturers that I spoke about, were also on AOTA's 100 influential people list. Some fun facts about her is that she actually rode on the OTAC 2017 OT Centennial float at the Rose Parade along with our very own Dr. Heather Kitching. So I thought that was really cool. And she is actually speaking at the AOTA Inspire event this year. So if you can go listen to her talk, that would be awesome. So some quotes that I wanted to share from her lecture were, the task of the occupational therapist is to determine at what level the individual is functioning in the various aspects along the developmental continuum, and to program for facilitating growth and development in each of these areas in accordance with the needs of the individual and the demands of his age. And we appear to be on the threshold of abstraction and conceptualization in working towards mastery of the understanding of the essence of our profession. In order to move us towards mastery, selected relevant activities and relationships will be needed to nurture our continued growth and development. So some themes that she touched on are multiple that I've already mentioned in my analyses of Mary Riley and A. Jean Ayers' lectures, but they are developmental theory, shifts in OT practice, and defining OT. Lorenz discussed the importance of developmental theories of multiple theorists, including Ayers, Freud, Erickson, and Giselle, and how they related to OT. Developmental theories were a hallmark of the era and showed that the lines of thought during this time were that each step of development was preceded by a step that must be completed or mastered before moving on to the next. In contrast, many theories and models today are systems-based, such as the PEOP model, which discusses the interaction of various factors rather than using a step-by-step process. Lorenz also illustrates the shift in OT practice at the time to scientific evidence-based practice by highlighting the many influential developmental theories of the time. She also touches on the profession being on the brink of defining itself and understanding the value that OT brings to society, which was an overarching theme of the Eleanor Clarke Slagle lectures of the 1960s.
So in conclusion, we will have first a summary of the themes. We have defining the profession, both the function and the value, preservation of the profession, theory development being philosophy and ideology, as well as developmental theories at large. Those were very popular for the 60s. Challenging educational standards, encouraging scientific inquiry, and shifts in practice. Many of these themes are still relevant today. We still, whether you find it frustrating or kind of true to the profession, we still are struggling with defining the profession. We're challenging education standards. As we all know, there's going to be a shift to the doctorate level of education coming in the pipeline. There are also shifts in the practice, like we're seeing new practice areas spring up. I even just in the last 6 months found out about occupational therapy in prison. I didn't even know that existed. And then some of these themes in OT mirror the overall cultural shifts of the 60s, when people were really starting to question things and starting to really seek more than just, I guess, kind of the surface value of stuff. So we started with Mary Riley in 1961, emphasizing the need to define the profession of OT, and we ended with Leo Lorenz mirroring the same sentiments and needing to understand the essence of our profession. So we end the decade of the 60s the same way we started it. In the words of Wilma West, depending on the perspective and purpose of the individual doing the analysis, this measure of our first 50 years might be impressive, discouraging, or inconclusive with respects to the net accomplishment. So we look forward to seeing you all in our learning activity in class. We think it will be a little fun, maybe silly, engaging, and we'll see you then. Thank you, guys.